Hello everyone and welcome to the today's session on low sperm count brought to you by Apollo Fertility. To speak on this topic, we have Dr. Suyesh Bandekar here. He is our internal infertility specialist from Thane Center of Apollo Fertility Clinic. To talk about our renowned doctor, he has done his MBBS and DNB in obs and gynae, and he's a gold medalist in reproductive medicine. And we're looking, and he's going to talk about low sperm count, which is the one of the big reason for infertility amongst men. So the problem, so whatever we need to know about, I'm sure Dr. Suresh Bandekar is going to speak and help us out understand it much better way. So we're looking forward to hear from you, and it's all yours.
Thank you so much. First of all, a very good afternoon to everyone over here, and thank you for that kind introduction. So today we'll be discussing about a very common topic and an important topic, that is low sperm count. So it's like very unfortunate, even in this era in the 20th century, we actually are dealing with a situation where uh, the low sperm count or infertility is considered to be only a female centric problem, but actually this is not a case. Uh, as we all know, the pregnancy per se, the pregnancy is made of the sperm and the egg, so it is like 50% from the male end and the 50% is from the female's end. So it's like both of the partners, the male and the female partners, are equally responsible. So we should understand, yes, it's not only the female, it is the male partners also who might get affected, and yes, they need some treatment for that. So this particular social taboo has to be removed at certain point. So we as fertility specialists, we always take it as a couple based approach, in which we usually suggest not only testing the females and only at the first go, we also suggest a simultaneous approach, going ahead with a male partner and a female oriented diagnosis and treatment. So once the only thing that we usually suggest for the males is the semen analysis. That is the most important and the only test that we usually suggest for males. So let's come to the topic, that is low sperm count or oligospermia. So how do we define it? It's a male fertility issue which is characterized by decrease in the sperm count. All right. So just to highlight, there is a lot of miscommunication, or there is myth around it that yes, if you have low sperm count, your sexual life is also affected. But just to be like very honest, to highlight on that, almost 99% of the males who are affected with low sperm count doesn't have any other sexual or any physical deficiencies as such. Their sexual life is completely normal, only and unless when your hormonal parameters are deranged, in which your sperm parameters and the sexual life may be compromised to certain extent. So when do we go ahead with the semen analysis? So we have to understand, once a couple is not able to conceive, like they are not able to conceive for 6 months or 1 year or 2 years, it's not only the females that has to be tested. The males are also can be responsible for that, and hence we recommend doing going ahead with the semen analysis. Secondly, once the males are known to have certain risk factors, like they had a testicular trauma, or they had a history of varicocele or hernia, or any groin surgery for that matter, in that case also sperm analysis is much indicated. So maybe we'll have to test the males first and then the females. So, what do we mean by semen analysis? It is basically going ahead to see how is the sperm count, the sperm motility, the makeup of the sperm, that is the sperm morphology, and various other parameters. So, it's not only oligospermia. It's like once we have this oligospermia, it's rarely only one parameter of the sperm is affected. It might be that yes, your count is also low, the motility of the sperm is also low, and also the morphology, that is the makeup of the sperm, can be affected. So it can be a variation of all these three. So how do we classify this low sperm count or oligospermia? So we come across a lot of reports which is like semen count of 90 millions, 150 millions, 180 millions. Sometimes it is like 1000 millions also. But yes, these are like the reporting errors. WHO has given us a strict criteria in which the normal criteria that they have mentioned is like whenever you have a sperm count of more than 15 million per ml, that is more than sufficient for you to conceive naturally. So anything below that, less than 15 million, is considered to be low sperm count. Further, we have classified it into mild, moderate, and the severe one. So if you have a sperm count between 10 to 15 million, it is mild. When it is like around 5 to 10 million, it is moderate. And if it is like between 0 to 5 million, it is severe oligospermia. Also, just to mention, if you have like zero sperms, in that case, it is called as azoospermia. All right, so there is no sperms that is present in your semen. I'll come to that. I'll mention something about that also, but at the end of the series. So let's see what are the causes of it. The most common reason that we come across, especially in the Indian scenario, is addictions. So smoking, alcohol, drug abuse. So we come across a lot of couples, especially the males who were addicted to smoking. They used to smoke almost like 10 to 15 sticks a day, and now they have stopped it since 2 or 3 years. So see, in your teenage years or maybe during your college days, you used to smoke a lot. Now you're stopped from 5 years, 10 years. That doesn't mean that insult is not there. So insult has happened already. The damage has already been done, and that is going to affect your semen parameters. So this particular addictions per se is a well to know, a very known factor which is going to affect your sperm parameters. Secondly, hormones, your thyroid levels, the testosterone levels, these are going to influence your sperm parameters. So they decrease the sperm production altogether. Third is medication. There are certain medications which may affect your sperm count as a side effect. Like if you are a hypertensive, like your blood pressure is on a higher side, you are a diabetic patient, you are on any antidepressant or any psychotic medication is going on for you. These are known to cause some derangement in your sperm parameters. Secondly, if you have a known testicular trauma, or if you had some testicular issues like varicocele, hydrocele, or a hernia, or any groin surgery for that matter, that is going to disturb your testicular function, and it is going to decrease your sperm count to a certain extent. Also, just to mention, we have been into this lockdown for almost more than 2 years, and many of us were like on like a work from home fashion. So most of the guys and the girls, they use their laptops on the lap continuously for hours and hours together. So this radiation, not only the laptops but the mobile phones also, males usually have a tendency to keep the mobile phones in their front pocket. So these radiations is going to decline your sperm parameters to a very large extent. uh, we come across a lot of patients. I would suggest, frankly, I see more than 50-60% of the couples where the male partner is affected, the sperm count, the motility is affected. And the reason that we know is like the radiation and the environmental pollutant. Those are the reason why the males are getting affected. And secondly, there is a lot of uh, show off, and like there are many guys who go to hit the gym. They take a lot of protein supplements and all, but unfortunately they don't know that the protein supplements may have some steroid levels into it, and that is going to decrease their sperm count. So even that has to be taken into consideration. Now, let's come to the treatment aspect of it. So, how do we go ahead about it? So, see, in almost 80 to 90% of the cases, especially if it is like a mild case, natural pregnancy is still possible. Yeah, you may take some more time as compared to the other normal couples, but yes, natural pregnancy is possible, especially if it is like a mild sort of oligospermia. You may be given, we usually give you certain medications which is going to improve the sperm count and the motility to certain extent. These are not antibiotics per se. These are like antioxidant vitamins and minerals which are like good for the sperm. They're going to enrich the sperm to certain factor. In moderate cases, mild to moderate cases, when natural planning is not able to conceive, it is not helping you to conceive. In that case, we usually suggest going ahead with the IUI, that is the intrauterine insemination. The process is like very simple. We just track the follicular phase of your partner. Once she's into that ovulation phase, we take your sperm, we wash them, we filter out the sperms, we take only the good quality motile sperm, and then introduce into your partner's uterus directly. So this is completely painless procedure and OPD based procedure, and the results are beautiful as compared to the natural cycle. In yes, severe cases, if it is like count is like less than 5 million or 1 million, and the other parameters also deranged, that the motility morphology is also deranged, in that cases maybe natural planning is not a good option for you. IUI is also not a good option for you. In that case, we usually suggest to go ahead with an IVF or a ICSI, in which we directly take the eggs and the sperms. We do an intra the sperm injection directly into the egg, we create embryos and then transfer it. So that is IVF or ICSI. Just to mention a short note about the azoospermia, when we have lot of patients who are coming with a zero sperm count altogether, and we repeat it again, and same the semen parameters are showing yes the count is only zero. The good news is yes you can still conceive with your own biological child. In this, what we do is we extract your sperms directly from the testes. Yes, we have to do certain homeworks for that. We have to check your hormone parameters and physical examination is needed. But yes, if everything is fine, we can extract sperms directly from your testes, that is the TESA or the PESA, and we use it for an IVF with that particular sperm. So yes, you can still conceive if your count is completely zero. Just to conclude, I would suggest, if you're trying since 1 or 2 years and you're not able to conceive, please do your semen analysis. That is also an important parameter. And in case if you see that your count is low, please take help from professional help from a fertility specialist. See, right decision at the right time is going to uh, improve your results. See, you may wait for some time, but waiting too long is not going to create miracles. All right. So I would suggest just to take go ahead with that semen analysis. If it is normal, it is normal. If it is abnormal, at least you know that it's abnormal, and you can go ahead accordingly. All right. Thank you so much. Any questions from your end are like most welcome. Hello.
Sir, the first question is it curable with medicine only, or any other things are done in this?
Uh, See, once the parameters are deranged, there is no permanent cure to it. See, what we usually suggest is going ahead with the pregnancy as soon as possible, because we never know when the sperm count is going to reduce drastically. So, see, we usually give certain supplements, but those are like antioxidants only and vitamins and minerals combination. So, those are going to help you in making a sperm like of a better quality. The count may increase to certain extent, but I cannot expect a sperm count of 2 million to rise to almost 50 million. That is not possible. Okay, maybe a small change in, like, if it is like 10 million, yes. If within 2 or 3 months, I may expect a change of 12 million or 13 million. So certain good parameters are affected, but yes, I cannot expect like a miraculous change into that. Next question, please. If you can just read out to me the questions. I am not able to see that.
Sure. Does riding a bike for a longer time will that affect a sperm count?
Yes. That's a very important reason, especially see, once just on the bike, the particular engine is on the front only, just below your groin region. So that heat emission is also known to cause a drastic decrease in your sperm count. So not only bike riders, like we have patients who are like rickshaw drivers or truck drivers also, they are exposed to continuous heat, a lot of heat, and that particular heat is going to disturb the sperm production. So, if you're too much into bike riding, I would suggest try and avoid as much as possible.
Okay. Okay. Sir, are there any genetic or aging issues that hurt male fertility? And does family history does it play a role in this?
Uh, to certain extent, yes. Age, see, if you ask me personally, age, I would say a male can be fertile till the age of 50, 55 also. After 50, the sperm count reduces drastically, but till 50, he is able to reproduce normally. Secondly, the genetic part. If you have a history, if your elder brother or your father is affected with that low sperm count, he had taken a lot of time to conceive, you should take that seriously. All right. So there are certain genetic conditions, certain syndromes, certain genetic defects which are transmitted hereditarily, and they can affect your sexual life as well as in the reproduction also. So if you have that history, please do a fertility specialist ASAP, and then plan your pregnancy also accordingly.
So next question is, whom should we meet? Does a urologist also treat these issues?
Um, yes, urologists also treat them, but see, I would suggest seeing a fertility specialist is going to help you in a broader way. It's not only the male partner, as I mentioned, it's the male and the female partner both. So once we are like commencing with the treatment, it's not only for the male, it's like female and male going together hand in hand. So, see, urologists have their own roles. See, if we need some sort of difficult surgery, if we have a failed TESA or PESA, so recurrent failures are like known to happen. In that cases, yes, we might involve a urologist also, neurosurgeon also. But per se, these cases can be easily managed by fertility specialist. And the best part is, see, both the ends, like the male and the female partner, can be treated simultaneously, and we can achieve the goals.
Sir, does the food have impact on the sperm count? Is there anything which affects the sperm count, particular food item or something? Is there something like that?
Um, See, at such it's a very bad notion that we always come to a conclusion कि ये खाने से ये कम होता है, ये खाने से किसी को ये होता है, papaya खाने से pregnancy loss हो जाता है. See, these are all myths. I would suggest just try to avoid it. You can have whatever you want, but in moderation. If you want to eat vegetarian, if you're a non-vegetarian, that is perfect. So that is not going to impact your overall sperm count. Yes, but as I mentioned, smoking, alcohol, and drugs and all. So that is going to affect you in the long way.
Sir, what is the success rate of fertility or conceiving with a low sperm count? Is there any
See, we usually discuss the success in terms of percentage. So if I have a couple whose, especially the male partner is affected with low sperm count, but it is like in a mild range. Alright, we still ask them to try naturally for 3 to 4 months if all other parameters are normal. So what we have observed is like almost 90% of the couples do conceive in the next 3 or 4 months only. All right. Secondly, what we can give them an option is like we give them some ovulation induction agents. We track their follicular cycle. Once the lady is ovulating, we ask them to have relations. That is like a timed intercourse. So that is an advantage to it. So whenever we try in a natural way or by doing a follicular scans and tracking their ovulation period, the success rate is around 5 to 7%. All right. And to just add on it, like once we move to the second modality, that is an IUI. Okay, so the procedure remains the same. We track the follicular phase. Once the ovulation is happening, we do an IUI. So in that case, the percentage of success is around 15 to 20%. So that makes a lot of difference. Where is 5% and where is 15 to 20%? But in case if our 2 or 3 cycles also fail, then the next modality is going ahead with an IVF or ICSI. But the success rate here is around 60 to 70%. All right. But yes, we have seen a lot of couples who was like, if you have especially a sperm count of like around 1 million or less than 1 million also, going ahead with this IVF ICSI is going to give you a pregnancy for sure. Rather than you trying with an IUI. See, IUI is altogether not indicated only if you have a sperm count of 1 million or less than 1 million. But there are couples who go ahead with IUIs multiple number of time. It is not going to give you a pregnancy. It is like a waste of physical, mental efforts. You're attaching hopes to it. You're emotionally attached to your cycle. But if it feels it is going to give you a lot of degrement. So going ahead with an IVF or ICSI with that particular sperm count, I would suggest better to go with an IVF ICSI if you have a very very low sperm count.
sir, low sperm count is always associated as a taboo amongst men. So, how should they manage their emotional well-being?
See, unfortunately, what happens is, see, I being a male doctor, I do understand the male psyche also. See, if a female is affected, everybody knows. Yeah, it's always like a taboo that was initially since ages that yes, infertility है तो शायद female का ही problem है. But now things are changing. The awareness is increasing. People still find, especially males, still find where to vent out. They cannot let this particular problem, like they can share it with their parents or they can share it with their siblings or they cannot share it with their friends also. The only way they can share it is with their doctors. Yes, this is a problem, whether it's related to their sperm count or their sexual life also. So this is like a very important point. The males don't find out a particular way where they should like discuss their problems with. Sometimes yes, they are comfortable, but most of the times they are not comfortable discussing out these things with their family or their friends also. So here come the roles of our like a fertility specialist where we can help them out with. So basically, increasing the awareness is more important. Secondly, a good support from the partner. So we have a lot of couples where we have seen ourselves. The wife is actually more supportive. She is the one who's going to push the her male partner. Yes, this is it, and we have to go ahead. So that sort of strong support is needed sometimes. Yes, it was a taboo, but we have to remove the taboo. We should try to remove the taboo as soon as possible.
So no more questions. You can conclude with a message, concluding message.
Sure, sure, sure. Yeah, just to conclude, as I mentioned, uh, see, once you come across that you have a low sperm count or your other semen parameters are deranged, or even for that matter, if your wife is having a low AMH, you as a couple should be strong. See, you if you have sperm, if you have an egg, a pregnancy is still possible. All right, you need to be strong for that. The only thing is which I would mention here is you should take right decision at the right time. If you wait too long, yes, you're taking some sort of treatment, but if it is not in a right direction, it is going to take time, and with time things change. So whatever is possible today may not happen in the next few years. So maybe you should take that initiative, seek help of a fertility specialist, and things change. Believe me on that. So I would suggest avoid too much of Google, because it is going to give you a lot of exposure. This is possible, this is possible, and everything leads to a cancer ultimately. So better to seek a fertility specialist. We are there to help you out in each and every situation. Wishing you all the very best. Don't be afraid of this low sperm count or any fertility problem. See your fertility consultant. Thank you so much.
Thank you so much, sir. Thank you so much. It was very informative and a good session. Thank you.
Yeah, thank you.